There is an app which is absolutely fantastic and has a big impact on quite a large number of people. It saves money, it allows people who might not engage with a physical service to engage with a service remotely and do things from their home. And the technology saves money, it adds value, but had a real tough time breaking into the system. And the reason is that the original sale of that device and technology was around replacing part of a system. And that meant dealing with hospitals to buy your product, which is going to compete with your hospital service and be paid for by a clinical commissioning group, the CCGs, who are the payers who effectively commission the service. There is therefore a massive conflict. If you're going to be going into a pathway and you're going to be competing with part of that pathway, you need to find a way of being embraced to be in that pathway. You need to be talking a language of collaboration, you need to be co-designing how your product is going to fit, you need measures that allow you to show the benefits that you create in the context of the existing pathway. The more you try and change something, the harder it is going to be to get it embedded within the NHS. We have very simple products that are very easy to get into the NHS because of the natural structure. So for example, in diagnostics, we have various tools where it's very simple. You ask for a test, the test is sent away, it comes back with a result. And that is a very clear pathway which hundreds in every hospital of providers will offer. And then there are the more complex things around day-to-day management of patients and platforms which patients will use as a means of communicating or self-managing or delivering information between clinicians and others. Those sorts of things become massively complicated and almost impossible to really embed because the amount of touch points, the amount of information sharing that is required, the integration and interoperability that's required to share that information, and the maintenance of it is just overwhelming. We are moving towards a world where some of these things are becoming possible, and that's only because of the world of integrated care. So we're moving from a transactional relationship between the commissioner and the provider to a more consistent long-term view of relationships between clinicians and their patients as a partner. And as that partnership strengthens in an integrated care environment, where your GP and your hospital visits and your social care management and your community management and mental health management are all managed under one banner, you're able to see how that gives an opportunity to start cross-talking and embed platforms. But it's only really in that environment where I'm seeing relevant uptake. Trying to change a single respiratory pathway in a given area, it's going to be very difficult to embed that sort of platform. It needs to be a way of overlaying on the transactional relationship within those pathway designs if you really want to succeed.